Hi everyone, I'm Sheridan Nichols. Welcome back to the show, and we are going to talk to Jackie Everett. Thank you for being with us today.
Thank you for having me.
She is with Wellmont Hospice, and this is a great time of year to be talking about hospice and sort of acknowledging that it's such a special need that we need in our community, and as people are getting older, it really helps in terms of when someone's passing, a place for them to go that's comfortable and nice, and families can go in and you feel good about the experience. So welcome to the show. Thanks for being with us, and thank you for sharing a little bit about what hospice is all about.
Well, one thing I'd want to add is that hospice is not really just about the hospice house. We are very, very fortunate in our community to have the hospice house. Most people don't realize that the hospice house was the first freestanding licensed facility in the state of Tennessee.
Wow.
When we opened our doors in 1996. So we've been around for a while. It is very wonderful for our community, and we really, really appreciate all the community support that we get. But we really are a home-based program. Most hospice programs are. So what we do at the hospice house is offer support to people who are dealing with end of life. It is an area where they can come for a short-term stay to get symptoms under control. They can come there for a short-term stay. It's typically 5 days of respite. And that's designed because they are being taken care of at home, but the family just really needs a little bit of a break. So it's not really intended to be someplace they can be instead of being at home, but sometimes it does become that just because of the nature of what we do and what's going on with our patients.
And it's just nice that we have the option.
Yes, it is a wonderful option. We really need more of them in our area. We are still the only facility between Knoxville and Charlottesville, although I have heard recently that they're getting ready to build one in Roanoke.
Oh, okay.
So, you know, it is becoming more popular. Hospice has really been around since the 80s. The hospice Medicare benefit was developed in 1984.
Okay.
And so anyone that has Medicare is eligible to have hospice services. But it's also covered by Medicaid and most major insurance companies, private insurance, and we are a not-for-profit organization, so we do offer services to those who don't have insurance as well. But the goal is always to help those people who are dealing with life-limiting illness to have resources that can come to them to honor whatever their end-of-life issues are. Whatever their wishes are, that's what we want. We want to be able to respect them. It's not about death and dying. You know, and I really want to make that point because a lot of people feel like, oh, it's hospice, you're going to talk about dying. No, it's hospice, we're going to talk about living and what we can do to help people. You know, everybody wants to make a bucket list. Well, when you have a little bit more idea of what your time frame's going to be because you're dealing with a life-limiting illness, then we really want to help you make that bucket list come true. So, yes, we do take care of people in their home. We do take care of people at the hospice house that are very close to the end of their life, but we also take care of people who, you know, want to go to Disneyland or, you know, want to be able to just spend more time with their grandchildren. Right now with the holidays coming, it's a difficult time for some people to deal with death and dying, so it's really important that that's as special as it can be. You know, we want them to be able to have a very wonderful family time with their grandchildren or whatever that they want to do. So it's all about making the most of every day.
And if people are unfamiliar with hospice, or at least are just now listening and thinking, oh, you know, this is going on in my family, this could help, how do they find out a little bit more or what the best option would be for them?
Well, they're more than welcome to call our office at any time, which is 423-844-5252. Nowadays, most people are internet savvy, so there are a lot of internet resources. The NHPCO, which is the National Hospice Palliative Care Organization, has a lot of information for the public. There's also Care Connections. That is a wonderful resource that you can look at what's available in your area. They actually can rank different services. We're not the only hospice provider in the area, and people have the right to make a choice of their provider. But we are a very good provider, obviously I'd say that. We have a very, very good program. Internet research will really find out a lot of information.
What are some common questions people call you or that you've heard over the years?
Well, because we have an inpatient facility, we do get the phone calls a lot saying, how do I get my loved one there? But there's also questions, some of the myths would be people think that, it is a place that you come to. But hospice is not just about the place, it's about dealing with the experience. What we do today is going to impact our family for generations to come. So we're really good about planning things like we're going to have a birth in the family, we're going to celebrate a birthday, we're going to celebrate graduation, we're going to celebrate retirement, but we don't go to the next step. As a nation, we're very poor at planning, okay, we've had a wonderful life, but what do we do when it's time to think about the end? So typically when I get phone calls, it's someone who's very distressed and I don't know where to turn, I don't know what to do, help me understand. And then besides patients' homes and the hospice house, we do provide hospice in nursing homes, in assisted livings, actually in group homes. Nationwide, there are lots of programs that go into just about any care setting. I've done this about 20 years. I've actually taken care of someone who lived in a cave.
Oh, wow.
And we've taken care of people who live in mobile homes, like the pull behind your car mobile home, and motels. So just wherever the patient is, because home is what they say it is, just like your family is who you say your family is. So it's not just always that traditional nuclear family, but we offer not only the nursing services to help deal with those problems, but we also have medical social workers who can help to deal with the non-medical stuff. We have chaplains, counselors, we have hospice aides who can come and help with the personal care, the bathing and bed linen changing. We have a very wonderful dedicated group of volunteers who can offer short-term respite in a patient's home, and then there's a lot of them that help us at the hospice house as well. And then the other thing most people don't know about is that we follow the families of our patients for up to 13 months after the patient has passed.
Oh, wow.
So we do very extensive support groups, we do a memorial service twice a year.
Nice.
So we do a lot of follow-up.
Right.
It's a very holistic approach to care. It's really looking at what do you have, what do you need, what do you want.
And making everyone
and
comfortable.
making it as comfortable as possible when you're facing that end of life.
That is great. Well, we're so excited that you came on today. Am I missing anything that you wanted to add?
Well, November is National Hospice and Palliative Care Month, so
yes,
I
we need to
appreciate the
mention
opportunity to be here to talk about that. One of the other big things that we really like to talk to people about is advanced directives, and that's something that whether you're dealing with a life-limiting illness or not, all of us need to be thinking about and communicating with our loved ones how we would want our care handled if something were to happen to us. When you have a known illness and a limited lifetime, you really start thinking about, okay, how far do I want the doctors to go? But the reality is, any of us could be injured in a car wreck, have a catastrophic illness, anything. So we need to be able to make our decisions known, and the way we do that when we can't speak for ourselves is advanced directives. Advanced directives is basically a document that says, in the event I cannot speak my own wishes, this is what I want.
That's great.
And typically in the state of Tennessee, you really can designate whether you want antibiotics, whether you want IV fluids, whether you want tube feedings, whether you want to be put on a ventilator, one of the breathing machines, whether you want to just do that for a short period of time or you don't want to do it at all. And it's extremely important that not only do people have those documents, but that they've appointed someone else to be their surrogate. So the document does allow you to say, okay, I want my cousin, or I want my husband, or I want my best friend from high school, because I know they'll respect my wishes. And then to make sure that all of your healthcare providers, your physician, your dentist, your whatever, knows what your wishes are, and that you have those documents filled out and kept in a safe place. And so that if you do go to the emergency room for some reason, they're on file at the hospital where you typically go, and your loved one is available to say, wait a minute, we've had this conversation. I don't think they'd want that done. Or, yes, please, go ahead, do everything, because that's what they want.
That's great. Yeah, these are great tips. Good things to know.
Yes, it is.
Well, we really appreciate you coming on.
appreciate the
and
opportunity.
We've all learned a lot about hospice, and thank you so much for sharing
Thank
this
you.
wealth of knowledge with us. And if you want to know about how you might be able to volunteer, we'll have some ideas when we come back.